Hello, everyone. My name is Emily Tiemann, and I'm delighted to be speaking with you all today representing Economist Impact. So in this presentation, I'll be sharing the report we recently released, which outlines a global blueprint for cervical cancer elimination, incorporating learnings from Sweden's programs. So just to share some quick background and numbers first on cervical cancer, it's globally the fourth most common cancer in women, and the burden really has been increasing over the last few decades, with data showing that the incidence of cancer has increased by 68.5% and deaths by 52% since the 1990s. One of the unique things about cervical cancer is that it's highly preventable, thanks to the development of the HPV vaccine that was first approved in 2006. And HPV infection is the leading cause of cervical cancer, causing more than 95% of cases. So many countries have already come a long way to limiting the growth of cervical cancer through vaccination, but also through other preventative measures like better health coverage and screening of women, which can lead to earlier diagnosis. But more needs to be done. Global vaccination coverage is still very low at 13% of eligible girls being vaccinated worldwide, and there are big disparities in the vaccination coverage. So without more intervention, like better coverage and screening, the global incidence of cervical cancer is expected to grow by 700,000 in 2030, leading to 400,000 preventable deaths. So why is now a key time to be focusing on this? Well, in 2020, the WHO released the Global Strategy for Cervical Cancer Elimination, which set out some key targets that should be met by 2030 to help achieve cervical cancer elimination before the end of the century. So you can see here in the graphs, the pink is the status quo and the blue is if the elimination strategy is implemented and achieved. So there's quite a difference in both incidence and death. Countries have also begun developing their own national strategies, and there are also regional strategies. For instance, Europe's Beating Cancer Plan, which includes targets for the elimination of cervical cancer. So thanks to those clear targets and goals, several countries are close to meeting or even surpassing the targets. And these countries have a lot of lessons to offer the rest of the world, and that's what we wanted to show from this report. So the main objective was to share the best practice of Sweden's HPV elimination program as a preventative measure for cervical cancer, since Sweden is one of the countries that is on track to eliminate cervical cancer actually by 2030. So we did that by doing an analysis of best practices and preventative interventions to reach those elimination targets, looking at prevention through vaccination, but also screening and treatment. And we use Sweden as a primary case study, but also include examples where other countries have done well to get insights from different types of economies and environments. So for the Swedish case study, we built a timeline of progress on vaccination and screening program. So the vaccine was first approved in 2006, and it introduced pretty much straight away, first for 13 to 17-year-olds, then 10 to 12-year-olds, then 9 to 14-year-old girls, keeping up with global recommendations. So it was introduced in schools in 2012, as well as catch-up program for older girls, and it started being offered to boys in 2020. And there was another catch-up program in 2022. For screening, the national program was first rolled out in 1967, and HPV testing, which is the recommended test by the WHO, was introduced in 2015. Self-sampling, which is a way for women to screen for cervical cancer from home, was introduced in 2020 as an emergency measure during COVID, and it worked so well that it was introduced nationally in 2022. So with regards to the WHO targets, Sweden is on track. The incidence of cervical cancer in Sweden has decreased from 24 per 100,000 women in 1965 to 8 per 100,000 women today, which is getting really close to the 4 per 100,000 women elimination target. So what did Sweden do differently to reach those numbers? This was mostly thanks to the organization of the programs, really going out and inviting people to be screened and having vaccination at schools rather than relying on people to do it themselves. So the system of organized interventions was really pioneered in the 1960s by Scandinavian countries, and it gradually spread to other countries since then. Advocacy and political buy-in is very strong in Sweden. There are many advocacy groups and patient organizations which work with the government. Sweden also does a lot of evidence-based decision-making, partly because they have comprehensive registries of population healthcare data, and the National Screening Registry captures 100% of the cervical cancer screening data. Researchers conducting population-based studies don't have to ask for permission to use patient data, and researchers in Sweden use those studies to show evidence to policymakers for the introduction of specific interventions, as well as to analyze the impact of those policies. So I mentioned self-sampling for HPV testing, which became routine in 2022. Next one is catch-up vaccination. So Sweden really pioneered a catch-up campaign in 2012 to help make sure that girls aged 12 to 18 who were not too old to be eligible for the max vaccination programs in school didn't miss out. And finally, looking at barriers to vaccination and screening in Sweden, there has been a lot of dedicated research done to identify and understand these, and there are some specific campaigns which target non-attenders. So there are a lot of lessons here on what works well, and the hope is that other countries can learn from Sweden's experience and introduce programs similar to these. So in the report, we have a section on implementing a successful elimination strategy globally, and we describe a 10-point plan, which is based on published evidence, insights from experts we interviewed, and also lessons from countries that are leading the way to cervical cancer elimination. So the plan really is for policymakers and other stakeholders worldwide to consider when developing national strategies to eliminate cervical cancer. So going through these one by one, they should build political commitment and momentum, ensure multi-stakeholder collaboration, prioritize HPV within national cancer policies and vaccination schedules, generate data through the development of robust registries, include screening and vaccination under universal health coverage, understand the target population and design the rollout of organized and accessible immunization programs, ensure equitable vaccination and screening access for the entire population, address the barriers of vaccine hesitancy and misinformation, ensure equitable access to high-quality treatment and optimal care pathways, and finally, learn lessons from the COVID-19 pandemic to build system resilience and scale screening and vaccination coverage. So in conclusion, we found that many countries have made significant gains in their efforts to eliminate cervical cancer. Sweden is set to achieve this by 2030. Australia is another example, which is set to achieve this by 2035. So countries really need to demonstrate that political commitment to achieve this goal, make sure it's built on evidence-based decision-making. The 10-point plan can form the baseline of actions for each country to consider when developing national strategies and implementing measures aimed at the elimination of cervical cancer. And eliminating cervical cancer is very cost-effective, so will help alleviate fiscal pressures, but it's also really important to ensure that women are protected from this highly preventable cervical cancer. Thank you very much.